A very warm welcome to the inaugural class of the Parkinson School of Health Sciences and Public Health. Let me say that again. To the graduates of the Parkinson School of Health Sciences and Public Health. Today is a significant milestone for you as well as for us. A little over a year ago, Loyola University launched the Parkinson School. It was through their visionary leadership and their deep commitment to being persons of others that Loyola alums Bob and Betty Parkinson, along with their family, made a lead gift to establish our school. It was through their exceptional generosity and their commitment to the health sciences and to public health and to an entrepreneurial spirit that the Parkinson are helping us found our school and educate the health workforce of tomorrow. Parkinson graduates, you are that health workforce of the future, all 128 strong of you. You are the leaders we so urgently need right now for the health challenges we are facing today. Certainly, you never could have imagined that upon graduation in 2020, you would be entering a world stuck and struck and hurting from a global pandemic, amplified by a nation's legacy of institutionalized racism, and brought into sharp focus through the death of George Floyd in the custody of Minneapolis police officers. Our world needs each and every one of you to combine both compassion and scientific knowledge to action for social good and change. I know, for example, that many of our medical laboratory scientists will be called to be experts managing labs and running thousands of COVID-19 tests. Our public health graduates, many will be called to lead efforts to implement contact tracing and mitigate the spread of the SARS coronavirus. I know our nutrition and exercise science graduates will be called to find new and innovative ways to maintain nutrition and physical activity in a time of social distancing and economic upheaval. And our healthcare administration graduates will be called to reinvent how we deliver healthcare in real time during an infectious disease outbreak. But importantly, the public is also witnessing the value of having a strong public health infrastructure and healthcare system, and its critical role in supporting one another in the health and economic resiliency of our society itself. I hope that some of you will contribute your talents and your expertise and your energy to advocacy and shaping policies for strengthening that fabric of our health system and for eliminating its health disparities. You know, this year is another momentous occasion, the 150th anniversary since Loyola University opened its door. And as I reflect on this milestone, I also take pause to note that during the last century and a half, the world has persevered through 5 global influenza pandemics, eradicated smallpox, and established effective prevention and control strategies to reduce the impact of many other major infectious diseases. This gives me confidence as we all rise to the challenge of COVID-19. Each of us is called to be a health entrepreneur, that is to be agile in identifying new approaches and solutions and reimagining how we do our work. I have such pride in our health science and public health professions who are innovating in real time on the front lines at a global scale. As Loyola graduates, I challenge you also to remember in your work to protect the most vulnerable in every aspect of what you do. The words of our guest commencement speaker, Dr. Linda Burns Bolton, and her call to action to us to choose to be equitable rings so true. And I know that Loyola University Chicago as an institution and as you as individuals will do the hard work that's necessary and needed to address systemic racism and its negative effects on health. So as you move forward from your time of Parkinson, I know you may be feeling a mixture now of emotions, joy, pride, fear, uncertainty. But know also, as the inaugural class of Parkinson School graduates, you have the knowledge, you have the tools to lead the way and to meet the challenge of our times as you apply your expertise and live a Jesuit value of being a person for others. We have our trust in you. So on behalf of Parkinson Interim Dean Dr. Kathy Bobet, our faculty and staff, and his founding dean, know that we are all proud of you, our inaugural class of Parkinson graduates. We wish you health, happiness, and a rewarding career ahead of you. I look forward to the day of welcoming you back to campus as Parkinson alums, when I hope I have the opportunity to shake your hand and exchange a hug. I would now like to invite our student speaker, Lucia Garcia, to share a message with the class of 2020.
Thank you, Dean Morato. My name is Lucia Garcia, and I am honored and grateful for the opportunity to speak with you at the first ever Parkinson School of Health Sciences and Public Health's graduation ceremony for the class of 2020. Today, we celebrate a new and incredibly important milestone in our lives. We represent diverse and unique graduates from Loyola University Chicago who've completed a rigorous curriculum that has prepared us to innovatively address the challenges in our world. Since my first semester in the public health program, I've been challenged to delve deeper into investigation to better understand the complex issues that impact our communities. I grew to be increasingly interested in policy and the long-term and deep-rooted impact that it has on individuals. I've learned to appreciate the differing perspectives of my colleagues, and I'm grateful for the opportunities that I've had to practice scholarly creativity and exploration. I'm incredibly grateful to the dedicated faculty and staff who pushed me and my student colleagues a little further, inspiring us to think creatively toward innovative solutions to ask the difficult questions of our society and of ourselves. Our Parkinson's faculty have created an environment that values students and prepares them to lead. Each faculty exhibits true Ignatian values of social justice, whether it's a focus on free clinics, mosquitoes and the environment, global health, advocating for historically disinvested communities, impacting the health of vulnerable women and men in low-resource settings, gun violence prevention and advocacy, community nutrition education, and so many more areas of focus. The public health faculty genuinely care about the issues that impact our communities. They're impressive men and women who've lengthy publication records, accolades, and awards. And while these accomplishments are no doubt impressive, the most notable is their unwavering dedication to students. Like many of my colleagues, I balance several full-time roles as a part-time master's in public health student, including a full-time career, being a full-time mom to 3 intelligent, strong, and beautiful girls, and a wife to a supportive husband. I'm so very privileged to have had the opportunity to be in these roles, but the most important of these was being a mom. My children have inspired me to persist, to continue to learn, to question, to challenge myself, and to be a part of the change required to ensure that our future does not continue to be plagued by inequities. My girls have taught me that I cannot stay quiet when I witness injustice. They feed my optimism and provide hope on a daily basis. My fellow graduates, there is great weight, substance, and responsibility that comes with our new accomplishment. I wholeheartedly believe that it is by no error or coincidence that we've reached this milestone during a uniquely challenging and unprecedented moment in our lives. A time when we've been met with a pandemic that has disproportionately impacted Black and Brown communities at an alarmingly higher rate than white Americans. A time when Black communities continue to be unjustly targeted and killed by oppressive systems of power that threaten their health and lives on a daily basis. A momentous time when we can no longer conform and accept that throughout our history, our nation and world have not valued the lives of some because of immigrant status, skin color, income bracket, sexual identity, or religion. These events have sharpened our social justice lens and enhanced our commitment to public health and evidence-based science. And how will we remember this uniquely challenging time? And how will we look forward with optimism and hopefulness toward action and our personal and professional responsibility toward one another? As graduates of a public health program and as graduates of a university committed to social justice and advocacy of addressing the needs of our communities, how will we be a part of the solution to achieve equity? How can we as public health professionals contribute to the change in our world that is crucial to creating an equitable and healthy future for our children? We must empower one another and be the voices for those who do not have voices. The degree we've earned today has not come easily or lightly. It comes with a responsibility to use the skills and knowledge that we've gained, our optimism and continued hope, and commit to take action. We are responsible for one another. To the dedicated Loyola Parkinson's faculty and staff, our friends and colleagues, and most of all, our families who've supported us throughout our journey, I wholeheartedly thank you for giving us the tools and support to be a change in our world. Thank you and congratulations to the class of 2020. I would now like to invite our keynote speaker, Dr. Linda Burns Bolton, to share a message with the class of 2020.
Good afternoon to each of you and your loved ones. It is my pleasure to provide brief remarks that I hope will inspire you as you begin your careers and help you to achieve everything that you want to achieve professionally. Congratulations to the graduates and to the outstanding faculty and staff of Loyola University. To the parents and family members, I hope you will celebrate with the graduates and join the faculty and staff as we acknowledge their achievements today and in the future. My remarks will be brief, but I hope you will walk away feeling inspired to do more to care for all. That's the essence of equity. So choose to be equitable. Darcy Graves from the Office of Minority Health at the Center for Medicaid and Medicare Services stated in 2019 that equity is a fundamental part of quality. I agree. It is essential that we work towards achieving health equity for all. What does that mean? We must go beyond competency training and the stratification of clinical performance. We must commit to the creation of a culture of equity. The implementation of quality improvement processes must underlie all dimensions of quality. It is essential that we make equity an integral part of quality. We must design interventions aimed at improving health outcomes with an equity lens. We must implement, evaluate, and adjust interventions continuously. We must retain and sustain interventions that are effective and discard those that are not as effective. We don't tend to do that as quickly as we should. We must provide health and social services that are equitable for all. This will require that we commit to closing the health disparities gaps that exist in our nation and around the world. The Institute for Healthcare Improvement identified the following framework to achieve health equity for the populace. First, we must commit to making health equity a strategic priority. Second, we must develop structures and processes to support our efforts to achieve health equity for all. Third, we must develop specific strategies to address the multiple determinants of health so that healthcare organizations and professionals can have a direct impact on the delivery of services and healthy behaviors. Fourth, we must commit to the elimination of institutional racism. There, I said it. It exists. Anyone who thinks it doesn't exist has their head in the sand. Fifth, we must partner with community organizations to improve health and ensure that the provision of equitable health and social welfare services exists in our country. Health equity, as defined by the Kaiser Family Foundation, is the absence of avoidable, unfair, or remediable differences among groups of people, whether groups are defined socially, economically, geographically, or by other means of stratification. We must commit, as stated by Professor Margaret Whitehead of the World Health Organization Collaborating Center for Policy Research, to work to assure that all individuals have a fair opportunity to attain their health potential and no one is disadvantaged from achieving their health potential. It is my hope that each of you will use your education to be of assistance to others. As members of the social and health professions, I urge you to commit to achieving health equity for all. Commit to fair and just health practices. Commit to the education of health professionals about the value of health equity for all. Support public policies that are actionable. Support programs to close the gaps in health care for all people. Adopt and support programs that are respectable and inclusive of all people. Foster and support the use of cultural reference in design and implementation of health and social services. We must be willing to call the circle, invite diverse voices to the table, and be willing to be open to others as we seek to achieve health equity for all. We must be willing to call out and speak out about unequitable services for all people. We must, as committed members of society, insist that all should have equal opportunity to attain and sustain health throughout their life. As we close out the WHO Year of the Nurse and Midwife, let us commit to the provision of equitable health care for all. As learned members of society, I urge you, I beg you, to stand up and demand that healthcare services be provided to all and for all people in the world. Congratulations on your achievements, and I know you will be successful. I look forward to learning about your contributions as members of the health and social services. Thank you very much.
And we would now like to recognize the 2020 graduates from the Parkinson School of Health Sciences and Public Health. Congratulations.
Thank you, Dean Murato. My name is David Shoham, and I'm the director of the MPH program. I am honored to recognize members of the class of 2020. I would now like to present candidates for the degrees of Medical Doctor and Master of Public Health. Pablo Luis da Silva. Nadim Tujo El Khoury. Kathy Fengyi Seng. I would now like to present the candidates for the degree of Master of Public Health. Aelia Akbar. Lillian Jane Anderson. Saida Bushra Ansari. Katra Baroque. Katie Evans. Lucia Helena Garcia. Jessica Marie Gardner. Kirsten Heller Gunderson. Haley V. Kapadia. Natrina N. Kennedy. Kayla Marie Crayer. Marisol Magallanes. Jonathan Montgomery. Simab Navid. Paula Paintsel. Bryn Howell. Luke David Salamoni. Devanshi Shah. Lauren Sue Simonelli. Rahel Woldemichael. Hibak Yusuf. I would now like to present the candidates for the degree of Master of Science in Dietetics, Certificate, Food and Nutrition. Madeline Butler Sanchez. Colleen Ryan Coffey. Jamie Francis De Laurentiis. Andrea Evelyn Inhosa. Emma Ann Jansen. Mary Beth Mora. Alyssa Marie Post. Kendall Ann Powell. Andrea Ravlin. Alexandra Schneider. Lindsay Sweetergall. I would now like to present the candidates for the degree of Master of Science in Exercise Science. John Ryan Flores de Leon. Connor Joseph Deal. David Chai No. I would now like to present the candidates for the degree of Master of Science in Medical Laboratory Science. Fatima Ali M. Al Salman. Duha Kadim A. Al Shalati. Saragan Dewan Dumarug. Esmeralda Escamilla. Christian Alejandro Estrada. I would now like to present the candidates for the degree of Bachelor of Science in Exercise Science. Kendall Page Ball, cum laude. Victoria I. Cantu. Cassandra Cisneros. Nicole Louise Cox. Crosby Estrada. Garrett Mark Firesel. Kevin Ray Ignacio Ferrer. Kella Nyala Freeman. Rebecca Marie Host. Zanera Jederick, magna cum laude. Kristen Marilla Lee. Julia Nowick, magna cum laude. Izodeosa Solomon Obaseki. Patrick R. Pastica, cum laude. Jennifer M. Perez. Madison Nicole Peterson, cum laude. Asha Dominique Rowland. Jayasara Rao Ruthala. Stephen Daniel Spalding. Arthur Adrian Stastiuk, magna cum laude. Diane Ashley Leal Villamina. Michelle Sarah Voitas. I would now like to present the candidates for degree of Bachelor of Science in Healthcare Administration. Layla Afshar, magna cum laude. Miriam A. Alasali. Jacob Alexander Hildebrand. Isba I. Ali. Natasha Alwyn. Tatiana E. Armstrong. Kasha Balick. Randy Michael Botvinnik, cum laude. Anastasia Shervinko. Lillian Grace Couch. Harris Delick. Jocelyn Michelle Dillard. Tiana Catherine Duclos Potter. William James Dunderdale. Victoria Digon, cum laude. Caitlin T. Ing. Delissa Escamilla. Thurens Jude Escobar. Christina Maria Gamboa. Frazil Gandhi. Chloe Hope Hartman. Josephine Nicole Inchesti. Kendall Chapman Jambor, magna cum laude. Irene Sophia Kesselman, magna cum laude. Asna Abir Khan, cum laude. Matthew Koalik, cum laude. Autumn Kreplin. Megna A. Kyriakos. Sabika Lakani, cum laude. Sunny Lee. Ambreen M. Mahdi. Gloria Micah, magna cum laude. Alexander Marshall Malish, cum laude. Allison Catherine Maceo Pinto, cum laude. Taylor Paige Meredith. Dira Mula, summa cum laude. Brenda Michelle Ortega. Brianne Monet Micaiah Parr. Madeline Porzak, cum laude. Ashley Kristen Prubacher, cum laude. Siddharth Manik Ravula. Ibrahim M. Rifat, cum laude. Odalis Iridian Rodriguez, magna cum laude. Darina Rybchenko, cum laude. Arvin Kenneth Salas. Safwa Salim. Noemi Stephanie Salgado. Jeffrey Carmen Schnobelen, cum laude. Lauren Chanel Seegers. Rima U. Shah. Alexander D. Sokolsky. Ria Soni, magna cum laude. Peter Arley Stein, magna cum laude. Abigail Tesh. Sarah E. Thompson. Bejoy Titus, cum laude. Kimberly Truong. Gregory J. Verghese. Mahami Virma, magna cum laude. Jennifer Volantovich, cum laude. Ja Min Zen. Ivy Mingwei Zhu, cum laude.